Stand down.
Let me just start, first of all, by saying that our hearts go out to all of the folks in the states that were hit so hard by those storms over the weekend, and we've been in contact with our Guard, and there's a process associated with supporting them, but obviously if any of those folks are looking for our help, we're going to do everything we can to make sure we deliver for them. Now, with respect to this morning, starting this week, our administration will begin distributing over 2 million free COVID-19 rapid at-home tests across Massachusetts. For this particular initiative, at the beginning, we're going to start by focusing on the 100 hardest hit communities in the Commonwealth. This is not just a one-time distribution of a one-time test. We are also in the process of working directly with test manufacturers to make available bulk, cheap purchasing deals for every city and town in Massachusetts. As many people know, we're already a national leader on COVID testing, and this program will obviously build on those efforts and that success. Like vaccines, these rapid at-home tests are potentially a game changer as we continue to battle COVID here in the Commonwealth. But the big problem in many cases for many people have been costs and supply, which have been major barriers. This massive distribution effort and the long-term bulk purchasing agreement will make a real difference here in the state. And before I get into the details of this program, I want to provide some context about how Massachusetts is using a variety of other tools to address COVID as we head into the winter months. Public health and medical experts have predicted that we'd see an increase in COVID transmission as the weather got colder. As we enter those winter months, we know we'll continue to see new cases. But that said, this winter is very different than last winter. We have many tools available at our disposal to keep people from getting severely ill that we never had before, and that's vaccines and booster shots. The vaccines work. They are highly effective at preventing serious illness and death, and nearly over 5 million Massachusetts residents, according to the CDC, are fully vaccinated, and we've been one of the top performing states in terms of getting our residents vaccinated for months. Roughly 75% of our population is fully vaccinated, and over 92% of our eligible population, which means residents ages 5 and up, now have at least one dose. That number overall is just over 6 million people. And unlike last year, those who are most at risk from getting seriously ill from COVID have protection from the virus. And now with the arrival of booster shots, we're providing our residents with an added layer of protection. Everyone age 16 and older is now eligible for a booster at the appropriate time. As of last week, Pfizer booster shots are now available to residents age 16 and 17, and all 3 boosters are available to people aged 18 and older. And so far, about 1,500,000 residents have gotten a booster here in Massachusetts. There are enough booster doses available for anyone who wants one. There's no supply constraint. And we've been asking our colleagues in local government and the healthcare community to set up additional clinics so that we can get these boosters administered faster. The vaccines and the boosters are helping us curb the pandemic and keep our economy open and our kids in school. As most people know, we've built a nation-leading testing infrastructure, which includes hundreds of sites where residents can get tested, and we're currently doing about 100,000 tests a day. In addition to those sites, we also do about 70,000 to 80,000 rapid tests a week in our schools, our K-12 schools around the Commonwealth. Rapid at-home test kits are increasingly providing people with another easy and convenient option to get tested for COVID. You don't have to wait for this test distribution program. These test kits are available at local pharmacies or can be ordered online, usually with delivery in a few days. They can be completed within 15 minutes and are a fast, easy, and convenient way to test for COVID. These tests will be especially helpful as we head into the holiday season. People can use them to check for the virus so that they can safely gather with family and friends. We've secured over 2 million tests from iHealth Labs. This week, we'll be delivering these test kits to 102 cities and towns across Massachusetts and asking local officials to get the tests out to those who need them in their communities. It's a big undertaking, obviously, and we can't do it alone. In total, these communities account for nearly 3.7 million Massachusetts residents. The kits are entirely free of charge for these municipalities and their residents. They'll be delivered by teams from the Mass Emergency Management Agency and the National Guard. The 102 cities and towns that will receive these test kits are communities in Massachusetts with the highest estimated percentage of families below the poverty level, according to the U.S. Census Bureau. The goal here is to help those families who face the greatest financial hardship and might have difficulty attaining rapid tests at a pharmacy. This morning, Lieutenant Governor Polito and Secretary Sudders spoke with local government leaders to let them know these deliveries would be on their way in the next few days on a rolling basis throughout next week. Our message to these local leaders is that we're here to help them as they and we work together in the battle against COVID. We also told them as local officials that they know their communities best, and that's why we're letting them determine the appropriate strategies for distributing these tests to their residents. In addition to this one-time delivery of 2.1 million tests, we're also working to make it easier and cheaper for municipalities to purchase these tests for their residents going forward. We're in the process of finalizing plans to allow municipalities and other public entities to directly purchase test kits from manufacturers at fixed state-negotiated prices. We released the request for proposals last Friday, and we are already involved in negotiations with a number of manufacturers, and we expect municipalities to be able to order these test kits in bulk by January. This statewide program will be open to all communities, and we believe it will further reduce barriers to access to these rapid test kits for members of the public. Again, remember, this program's in addition to this week's one-time delivery to 102 communities of 2.1 million rapid tests, and it will allow for a recurring supply for all communities on a go-forward basis. We'll obviously have more to share about this program in the coming weeks. As we approach the holidays here in Massachusetts, we're in a far different position than we were at this time last year. With vaccines and boosters widely available and the vast majority of our residents vaccinated, we have far more tools at our disposal to fight COVID this time. Kids are staying in school, our small businesses are open for holiday shopping, families are gathering this month to celebrate the holidays. But COVID isn't going away anytime soon. And if you're not vaccinated, you should get vaccinated. If you're eligible to get boosted, you should get boosted. You can get tested at over 100 sites, and as I said, 100,000 tests a day are currently being administered. And with this additional 2 million tests being distributed to our colleagues in local government in the 102 hardest hit communities, there will be options available for those local folks as well. We believe these acts and these activities can help protect those who are most vulnerable here in Massachusetts as we continue to move forward. And with that, I will turn it over to Lieutenant Governor.
Good morning, everyone. Thank you, Governor. As the Governor mentioned, this morning, Secretary Sudders and I joined a call with our municipal partners to explain the details of this week's shipment of rapid test kits. These 102 municipalities were selected because they are the communities with the highest proportion of families at or below the poverty line. Our administration was glad to work directly with the manufacturer of these iHealth Labs at-home test kits so that they can get them into the hands of our municipal leaders. These local officials on the ground know their communities best, and we believe they are best equipped to get the test into the hands of our residents. Whether it is through targeted outreach to families in need, public distribution sites, or other options, we know these communities can put these tests to very good use. It's also important to emphasize that this is just the beginning. In the coming weeks, we will further reduce barriers for communities to purchase these rapid test kits. As the Governor mentioned, we're in the process of finalizing a statewide initiative whereby cities and towns will be able to procure rapid test kits at much lower state-negotiated prices. This will allow them to sustain their efforts to get these test kits into the hands of the residents, especially those who might not be able to afford them. To secure these test kits, municipalities are also able to utilize the American Rescue Plan Act funding, the ARPA funding, as well as other federal COVID relief funding. Cities and towns across our state received over $3 billion in ARPA funds, and purchasing test kits is an eligible use of those funds. On this morning's call, Secretary Sudders and I emphasized to our municipal partners that we're here to help and continue the partnership that has worked so well over the last 22 months. Over the course of the pandemic, our communities, as you know, have played a very key role, including our local boards of health, where it was through their efforts to stop the spread of COVID, or most recently in the vaccine and booster rollout, their coordinated, in-touch engagement with their communities helped to make a real difference, saving and improving lives. We've worked so hard to be a strong partner to our municipalities, and today's announcement is another step of why this is important to work together, and how when we work together, we're at our best. We look forward to continuing to work together to make this a safe holiday season for everyone, and obviously start off the new year in a very good position. Thank you. I'll now turn it over to Secretary Sudders.
Governor, Lieutenant Governor, good morning, everyone. As you just heard, we are very pleased to announce the availability of 2.1 million free at-home COVID antigen rapid tests for residents across the Commonwealth for those with the most need. Throughout the pandemic, Massachusetts has been a national leader in COVID-19 testing, with over 34 million tests conducted at hundreds of testing sites across the state, including 38 state-sponsored Stop the Spread testing locations that are free to all residents of the Commonwealth. Testing represents one of several risk reduction measures, along with vaccination, getting a booster, and staying at home if you're feeling ill, that protects you and others by reducing the risk of spreading COVID-19. These iHealth Rapid Antigen COVID-19 tests represent another tool in our arsenal to beat COVID-19, and these fast, accurate tests can help prevent the spread of COVID-19, especially with the holidays upon us. Please consider using a self-test before joining indoor gatherings with others who are not in your household. The test can be completed by residents in their home. Test results are available in 15 minutes, and samples do not go to a laboratory. People do not need a cell phone or computer for any part of the test. The tests are available or are usable for any individual 2 years of age and up, regardless of vaccination status or whether they have symptoms. There's no mechanism with these tests to report results, and test results do not need to be reported to public health. However, people who do test positive should isolate for 10 days and notify their close contacts that they may have been exposed to COVID. As a reminder, residents can also opt in to Mass Notify. Mass Notify is the Commonwealth's digital exposure notification tool and residents can choose to enable the service on their phone. The tool lets you alert others that they have may been exposed to COVID-19 if you test positive, but can also let others, even strangers, alert you if you've been exposed. Just about 25% of Massachusetts residents are currently on Mass Notify. If someone needs help with support resources to be able to safely isolate or quarantine, they should contact their healthcare provider or their local Board of Health. Residents can also visit mass.gov/quarantine for information and resources on how to isolate safely. Finally, as folks prepare to gather with loved ones for the holidays, I strongly encourage anyone to get vaccinated, and if you're 16 and older, a booster. It's the most selfless gift you can give to protect yourself, your family, and your community. And today's initiative could not be possible without the extraordinary work of a lot of people, including my team, A&F, MEMA, and the Mang. And I just want to give a shout out to them. Thank you. Governor?
Questions?
Governor, in a nutshell, how many people will get the test in each family? And can you give us an example of how you want them to be used? And will the state be notified of the positive results and will count in the numbers?
That was like a lot. Let me start with this. Part of our objective here was to make these available in communities where we felt there was, to begin with, communities hard hit by COVID, and secondly, as I said in my remarks, those communities that were had the lowest numbers with respect to our counts around income and that sort of thing. Places where they would really make a difference. Rather than defining specifically how those might be used in those communities, we decided to make them available to communities, those 102 communities, and let those communities decide what the best process for distribution would be. There'll be some broad parameters on it, but generally speaking, we want them to do what they think makes the most sense. With respect to rapid tests generally, they have proven to be a very effective tool, especially for people who are going to be gathering indoors with folks they don't, either they don't know or they're not normally around. And I think in some ways, that's probably heading into the holidays, one of the more important ways people could use them.
Will they count towards the official numbers?
I don't think they will, because they're not. There isn't a process in place for that. And keep in mind, people have been buying rapid tests for a while. But one of the issues we wanted to deal with here was the fact that they're not cheap. And for us, the most important thing to do here was to make them available in those communities on a grand scale, that would make it possible for them to distribute them to a lot of the folks for whom the price tag is probably beyond their reach. I do think the fact that at some point in the not-too-distant future, communities will be able to replenish those orders and spend some of the federal money they've currently got, will make it possible for them to be a little more aggressive about how they think about distribution generally as we head into the holidays.
What can the other 250 cities and towns in Massachusetts who aren't part of this program do in order to get their folks tested?
Well, we're still doing 100,000 tests a day here in Massachusetts to begin with, and we're doing another 70 or 80,000 tests a week around our test and stay program to keep kids in school. This is what I would describe as one more testing tool in the toolbox, focused primarily on those communities where there's less likelihood that people have the ability to buy these on their own.
Governor, how far away are we, or is it even in the plans to do something like Colorado, where any resident of that state can go online and request a free rapid test through the state? Is that something you foresee in Massachusetts, or what other plans beyond this 2.1 million would you like to see?
I really think for us, the big opportunity is to get the bulk purchase agreements in place with a number of these manufacturers and then make that available to cities and towns to order and then distribute within their communities in whatever way they think is the most appropriate way to make it happen.
Governor, if price is an obstacle, how much did it cost the state for the 2.1? And what price do you want to get it down to for states and cities to get them at to that bulk purchasing agreement?
Well, since we're in the midst of a negotiation with the manufacturers at this point in time, I'm probably not going to answer that question. I do think it's important for them to be as cheap as possible to the communities and to the people in Massachusetts who are engaged in this effort.
How much did it cost the state for this initiative?
You want to speak to that? You asked about an open procurement.
I understand, I guess it's a two-part. That's
Right,
why I
right.
wanted to-
So we spent $10 million for the 2.1 million tests.
Is that from ARPA money, or?
I used state appropriation dollars, and we will seek FEMA reimbursement for it.
Are teams going door to door with these tests today, or when are they gonna have them in hand?
They'll be distributed to communities starting tomorrow and probably take 4 or 5 days to get them all out to everybody.
How accurate are these tests? Any false positives, false negatives?
The thing about antigen tests generally is their accuracy rates have improved dramatically over the course of the pandemic. I don't know the answer specifically to this one, but a number of the most well-known tests that sell in the community are north of 95% on both positive and negative test results.
Yeah, it's in the upper
Okay.
So this rapid antigen test, like other rapid antigen tests, right, are in the upper 90s in terms of effectiveness. So it's again, I think one of the positives of rapid antigen tests is easy, use at home. In this case, it's for anybody 2+. It's a non-invasive process, 4 steps, highly effective. So we think it's a really good tool in the toolkit.
And Secretary Sudders, what can you tell us about iHealth Labs, this company?
U.S.-based, California. And it's one of the 8 or 10 manufacturers that has received emergency use authorization by the federal government. So there's 13 EUAs, and I think it's 10 manufacturers. So they're California-based.
Sudders, is there
Yes.
a recommendation for when to take the test? Say it's Christmas, 2 days, 1 day before, any recommendation?
So again, I think the recommendation is if you're going to be in an indoor gathering with people like particularly you don't know, it would be that's one good example of when to take the test. Whether it's like on Christmas Day or not, that's really not the construct. It's really like if you're going to be in an indoor gathering with people you don't know, not sure what their vaccination status is, that would be a good time to take the test.
Is that what the state is advising as well? Because, the CDC came out last week and said regardless of vaccination status, you should take a rapid test before going to your holiday gathering. You have people saying, I can't find them at CVS. So can you speak to that just generally, rapid tests, holiday gathering, what do we do?
Well, part of the objective here is to make these available to many folks who don't necessarily have the financial wherewithal to do it, and to make them available so they can use them for gatherings of one kind or another. Let's face it, this time of year there are a lot of those kinds of activities, and I think what we're trying to do is to make it one more tool in the toolbox that can be used to make those events as safe as possible for people.
Governor, is there confusion around in the state of the building about whether it's a mask or not a mask? Is that still recommended? Some cities and towns have indoor mask mandate. Within this building, the governor's staff, no masks, legislative staff, masks. It's a little confusing. Is that confusion going to contribute to maybe not getting things under control in the long run?
Well, first of all, 6 million people in Massachusetts are fully vaccinated. 1.5 million of those 6 million have received booster shots. 5 million people are fully vaccinated. 1.5 million of those people have received booster shots. Another million people have at least 1 dose. The fundamentally best and most important way for people to keep themselves and their family members safe is to get vaccinated. And if you've been vaccinated and you're eligible to get boosted, get boosted. With respect to mask mandates, we have public transportation as a mask mandate. Long-term care has a mask mandate. Public schools have a mask mandate. Healthcare organizations have mask mandates. And then local communities, for a variety of different reasons, have put a variety of requirements and recommendations in place. This is about testing. And the most important element in this is about making tests, rapid tests, available on a broad scale to communities that have, in many cases, a lot of people who aren't going to be able to purchase these on their own, to make these tests available so that they can test themselves before they go to gatherings or other large indoor events.
Is there any
Well, today is the day, so we'll probably have more to say about that later.
Getting back to her question, what about people who can't afford them, but can't find them? Forget about it?
No, that's what the whole point of this exercise is. There are going to be 102 communities that are going to receive 2.1 million rapid antigen tests, and they will then make decisions about how they think they can best be distributed in their community to make them available to their residents.
But if they're available to people who, let's say, can't afford them, or they think are difficult communities, what about those, as I say, who can't afford them, don't qualify for whatever programs are available, and can't find them at their local CVS? I mean, other states have made them available more, widely available to everybody. If these communities make them available to targeted communities, what do you say to the people who can't find them on the shelves, who can't afford them and want to buy them?
Well, the reason we made this deal was to make 2 million rapid tests available in 102 communities that represent 3.7 million people in Massachusetts who will have access to these tests for free. In addition, you came in late. In addition to that, there's also a contract that's being negotiated currently to make it possible for cities and towns in Massachusetts, all cities and towns in Massachusetts, to purchase these tests on behalf of their residents off of our blankets, and they can use federal funds to make those purchases.
Last question. Are there any plans to bring back the statewide mask mandate as doctors call on you to do so?
There are no plans to bring back the statewide mask mandate.
Are there any triggers that would tighten restrictions in your mind if we see cases go up?
Keep in mind that we're in a very different place than we were in before. 5 million people are fully vaccinated, 1.5 million of those are boosted. Over 6 million people have at least one dose, and we continue to focus aggressively on those communities and those populations that are most vulnerable. There's a ton of activity going on in that space to keep those people safe. They're tested all the time with respect to COVID, and that's going to continue to happen until it doesn't need to anymore.
Insight on the breakthrough cases with vaccinated people, breakthrough cases. Can you just give us an insight why that might be happening more so? I mean, we're seeing those numbers go up.
Well, keep in mind that we've said this for a long time. The vaccines protect against serious illness and death. And I've also talked about the fact that if you look at the hospitalization rates of the vaccinated and the unvaccinated in Massachusetts, if the unvaccinated got vaccinated, it would drop our hospitalization rates by 50%. There's simply no question that the vaccines work. And if you look at the national data, there were about 120,000 people in the hospital with COVID at this time last year with very similar case counts nationwide. This year, there are 60,000. The main reason there are so far fewer people in the hospital this year than there were last year, with the presence of Delta and all that comes with it, is because of the vaccines. Get vaccinated. If you're not vaccinated, get vaccinated.
Thanks, everybody.
The hospitals activated the National Guard, are there any plans to activate here with this surge?
We're in pretty constant conversation with the hospital community about what makes the most sense here, and as I've said, if there are ways we can continue to support them, we have made a series of decisions based on those conversations with them to give them more flexibility around how they operate. We'll continue to pursue those.
Governor, the city of Methuen was ordered to return $650,000 in COVID federal funding, $500,000 said to be distributed and properly given as bonuses. Can you tell us about what that's about and if there's going to be an investigation into, I guess, the improper bonuses?
Well, if they give the money back, I guess what I would say is, first of all, we spend a lot of time with our colleagues in local government around what's permissible and what's not, and we want to make sure that they put those dollars to work in ways that are federally qualified, and this conversation we're having today about rapid tests is a good example of something that is reimbursable and they can use their federal resources for. But obviously, in those course of those conversations, if we come across things that we don't think meet the test, we're going to work with the locals to make sure that they figure out a way to correct for that.
Thanks, everybody. Will the state be opening more traditional testing sites for those who can't access these rapid tests? Just as we head into the holidays, and additionally, are we going to have more high-level booster sites? And those are coming, some of them already online. Just can you just quickly update?
Well, there are hundreds of booster shots available in Massachusetts today, and there are hundreds available tomorrow, and hundreds available the day after. we're checking those sites on a pretty regular basis. It may take a few days for somebody to get an appointment scheduled, depending upon where they live and when they can go. But we've continued to talk to our colleagues in local government about working with us to set up additional sites in places where we have a lot of traffic and a lot of activity. There's not a shortage with respect to available boosters. The issue for us is creating capacity. We have over 1,000 sites that are currently available. We're going to continue to work to see if we can build on that going forward.
So for testing, like just your swab testing sites, are we going to see more of those traditional or just?
100,000 tests a day is about the max we ever did at any point during this pandemic. The 38 Stop the Spread sites are all located, for the most part, in communities where folks don't necessarily have the resources to purchase their tests on their own. And if they can't find one, there are hundreds of testing sites available around the Commonwealth that people can access to get tested. But putting 2 million rapid tests into the mix, focused primarily on those communities that have got the greatest need, is another tool in the toolbox to spread testing infrastructure more broadly. And once we negotiate these deals to establish a statewide framework for this, all communities in Massachusetts will have access to that. Thanks, everybody. Thanks, everybody.